Within the body of this presentation, we'll be talking about pain assessment and management in children. We'll also be discussing what is pain, the pathophysiology of pain, the types and degrees of pain, as well as some factors affecting and influencing pain, the tools and types of pain assessment used in children, as well as some pharmacological and non-pharmacological methods, and developmental and nursing considerations used in pain assessment and management. What is pain? Pain, as defined by WASI 2022, is a complex process that varies according to the type, whether nociceptive, neuropathic, psychogenic, or the duration, whether acute, chronic, and is triggered by the nervous system in response to tissue damage. Pain can be steady, it can be throbbing, pinching, aching, or described in many other ways because it is subjective. Pain occurs wherever there is tissue damage, as it activates the pain receptors of peripheral nerves. In order for us to feel pain, the signal from the nociceptors, which are the many nerve endings that respond to painful stimuli in the peripheral tissues, is transmitted to the spinal cord and then to the hypothalamus. I have went ahead and attached a flow diagram explaining all of this for you guys' consideration. What causes pain? The cause of tissue damage, it may be physical, for example, hot or cold. It may be due to pressure, stress, spasm, ischemia, or chemical, where the pain-producing substances are released into the extracellular fluid surrounding the nerve fibers that carries the pain signal. While chronic and acute pain can be caused by an initial injury or a disease, for example arthritis, some children may experience pain without any injury or body damage. One common cause of pain in children are headache, abdominal, and musculoskeletal abnormalities. Types and degrees of pain.
Nociceptors are found throughout your body, especially in your skin and internal organs. When they are stimulated by potential harm, such as cut or other injury, they send electrical signals to your brain, causing you to feel the pain. Nociceptive pain is one of the most common types of pain, and it can be classified into acute or chronic pain, or visceral or somatic pain. Visceral pain results from injuries or damage to your internal organs. It can be felt in your trunk area of your body, which is your chest, abdomen, and pelvis, and is often described as pressure and aching or squeezing. The exact location is hard to pinpoint. For somatic pain, this results from stimulation of pain receptors in your tissues. It can be felt in your skin, muscles, joints, connective tissues, and bones, and feels like a constant aching sensation. It is easier to pinpoint the location of somatic pain rather than visceral pain. Neuropathic pain, also known as the nerve pain, arises from the nervous system itself, either as a result of injury or disease to the nerve tissue. It is more difficult to treat than nociceptive pain because it causes damages to the nerves itself, thus the sensation of pain may transmit to the brain even after the original injury has healed. It is frequently described as burning or shooting sensation and can lead to a heightened sensitivity of stimuli, even to the point of a dental touch being interpreted as painful. Pain response to non-painful stimulus is called allonia, and an exaggerated pain response to a painful stimulus is called hyperalgesia. Neuropathic pain in children can be severe and persistent and difficult to recognize and manage, which is associated with significant pain-related disabilities. Pain classification by duration. Acute pain is known as short-term, chronic pain is long-term. Acute pain lasts less than 3 months. The pain is directly related to soft tissue damage occurring from a risk of injury, illness, necessary medical procedures. Examples are sprained ankle or paper cut, and it gradually resolves as the injured tissue heals. It is the most common adverse stimuli experienced by children. Chronic pain, lasting more than 12 weeks, may be classified as chronic malignant or chronic non-malignant pain. Malignant pain is linked to particular cause like cancer or joint pain in the case of arthritis, and non-malignant pain is the original tissue injury is not progressive or has been healed, but the child still experiences pain.
And And here's an overview of the pain classification by duration. Feel free to pause the video here to take a deeper look at it.
Pain assessment in children. Pain assessment is a broad concept involving clinical judgment based on multidimensional observation of the type, significance, and context of the individual's pain experience. The most important indicators of pain are self-report measures. However, children are often unable to communicate this information due to age and/or developmental status. As a result, a variety of observational and behavioral assessment tools are used to effectively identify the type and degree of pain being experienced. These include the visual analog and facing scale, as only a child knows exactly how much pain they are feeling. The types of pain scale include numerical or visual, which include a child rating pain from 0 to 10 on the pain scale, with 0 being no pain at all and 10 being the worst pain they have ever felt. Here we have the pain scales showing 0 to 10, as well as the Wong-Baker's pain scale showing a face in no distress and most distress. We also have the pediatric pain questionnaire, which is used to evaluate children which are older and have chronic pain issues. This questionnaire analyzes the child and how they interact with normal activities to see how well they manage pain, or at what point in the activities they feel the pain. FLACC, which is face, legs, activity, cry, consolability. Each category is scored on a 0 to 2 scale, which results in total pain score between 0 and 10. The person assessing the child should observe them briefly and then score each category according to the description supplied. It has a high degree of usefulness for cognitively impaired and many critically ill children.
Pain management in children. Pain management is defined as a medical term that draws on the disciplines in science and alternative healing to study the prevention, diagnosis, and treatment of pain. Pain management in children are centered around pharmacological and non-pharmacological interventions. When applying these interventions, it is important to consider the age and size of the child. Pharmacological pain management. This includes the use of medicines such as opioids and non-opioids, typically administered by mouth, intravenously, or through a patch on the skin. Non-opioids. These work by blocking cyclooxygenase, the enzyme that sends chemicals called prostaglandins in the event of injury that makes our bodies feel pain. Non-opioids such as acetaminophen and non-steroidal anti-inflammatory drugs are known for their antipyretic, anti-inflammatory, and analgesic actions. This is an overview of the non-opioid drugs. At this point, you can pause the video to take a note. Opioids. These produce analgesia by action at several levels of the nervous system. In particular, inhibition of the neurotransmitters released from the primary afferent terminal in the spinal cord, and activation of the descending inhibitory controls in the midbrain. An opioid is usually given to a child experiencing moderate to severe pain. Morphine is the opioid of choice. However, when morphine is not suitable for use, hydromorphone, hydrochloride, and fentanyl citrate are used. This is a table giving an overview of the opioid drugs. Again, you can pause the video at this point to take note. Non-pharmacological pain management. This includes ways of alleviating pain without the use of medicine. This includes distraction, such as blowing bubbles, playing video games, or watching cartoons. Relaxation, which includes holding the child in a comfortable position or rocking the child for infants and neonates, or for older children, you can engage them in deep breathing activities. There is also guided imagery in which the child is guided through a pleasant mental image to help to shift the patient's attention away from the pain. There There is also positive self-talk, thought-stopping, behavioral contracting, psychological interventions, and hypnosis.
Factors affecting and influencing pain assessment and management in children. Pain in children can be affected by several factors such as age, their gender, cultural and family background and norms, as well as their perspective and level of understanding. With age, signs of pain in neonates and infants they are often missed as they are non-verbal. While toddlers might be able to truthfully verbalize their pain, school-age children and adolescents are typically afraid of expressing pain as it shows weakness. As for gender, a small boy will cry, but as they grow older, they may put a lot of effort into making sure they don't, particularly if others are around. Conversely, young girls may cry more because this behavior is deemed acceptable. For cultural and family norms, people of some cultures may express themselves freely, while others may repress their emotions or react in a way contrary to what is considered normal. For example, a 6-year-old boy who decides not to cry or express hurt due to his family and cultural expectations. Perception as well. Parents may sometimes downplay the child's feeling as something small or just a little bug, and children often adopt their parents' perception as their own, leading to inaccurate assessment and management of the child's pain.
Developmental and nursing considerations. It was believed that in the 20th century that children did not feel pain because of underdeveloped nervous system. Developmental considerations, they may consider neonates and infants. They're between the gestation of 20 weeks and they most likely have a eye-opening response to pain. Toddlers, they mostly have facial grimacing and they're between 3 to 4 years, and they also communicate pain with words, and they also use a self-reported face scale. School age and adolescents, they're a bit different. Between the ages 8 and older, they can use the unipolar scale, which is a scale from 1 to 10, and they also do physical observation. Some nursing considerations: assist the neonate by observing eye movements in response to pain. Show the child that you take their pain seriously. Tell them what is happening using words they can understand. Reassure them that their pain will be managed and that the treatment will be less painful. Encourage parents to come and visit the child in the hospital. Communicate in a way that the child would understand and that will help the nurse. Observe the child's facial expressions, and you can use the unipolar or the facial scale, as I said before, in order.
Plan of care.
So here we have an example of a care plan in regards to pain management. So name of patient: AB, diagnosis fracture to right femur, age 4 years old, and the data will be focusing on is comfort. So our priority diagnosis would be acute pain related to stimulation of nociceptors. The secondary is a fracture of the right femur as evidenced by cast the right leg, facial grimacing, clenching of the fist, guarding of the area, and a rated pain of 7 out of 10 using the face scale. You can go ahead and pause to read the entirety of the care plan here. And for a second diagnosis, we would have impaired comfort related to partial break in right femur, evidenced by cast right leg, facial grimacing, clenching of the fist, guarding of the area, and a rated pain of 7 out of 10 based on the face scale. So you can go ahead and pause to read this. We have come to the end of our presentation. Thank you so much for watching. Have the rest of your day.